Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about government policy and human rights. Welcome back to Policy and Rights here on Depictions Media Radio. I'm your host, Michael Hurley. Canada has some real issues, actually, more than Canada has real issues. The United States and other countries around the world have similar issues in healthcare, medical attention, and let's face it, medical attention or some sort of health care is can be vital to life, especially, for those who, when you become sick, we're coming out of a pandemic. There were millions, if not billions, of people sick around the world, and COVID has some long-term effects where the disease itself made the person's immune system turn against his vital organs. The treatments for it drained the same bodies of precious nutrients, causing long-term effects that maybe diet will help some of that, maybe other medical attention, but it all amounts to wellness and health care. And it's something that our human society on a global level, one, has to put effort into making things happen. We talk about in North America, and in other Western countries, we talk about what's happening in Syria, and we talk about what's happening in places like Afghanistan, where, simply put, the governments are limiting who can actually get medical attention and get care from doctors, rather they be medical doctors, holistic, naturopathic doctors, whatever those doctors may be, but they all have the same job, and that is to heal and to bring people back to health so that they can live happy lives. Now let's propose this, that one, there is a shortage of doctors, and let's say that because there's a lot of money backing a healthcare system, either because it is a pay up front sort of system like it exists in the United States, or it is because it is a government run or public healthcare system like exists in Canada. Either way, there's still a lot of money behind it, and a lot of funding needs to be put into the system in order to make it work, in order to make sure that people actually can get the care they need in a timely manner. Whether it is public or privately funded, at this point really doesn't matter when people are in long lineups waiting for treatments. And this is the situation that we have with the public system in Canada. People are delayed from getting treatment. trying to divert the money away from the public system and putting it into a newly formed private system may not be the best way to go. But something has to be done in order to ensure that lineups are limited and that people get the care that they need. So it's a real issue. Healthcare is a real issue when countries start pointing fingers at other countries saying that they're not supporting the humanitarian efforts in order to allow people to find healthcare and medication. When you have a system that has people with lineups that say someone while waiting for 5 hours for an ambulance to show up because they had a serious healthcare issue occur, and they live near a populated city, we might have a problem with our own healthcare system. And we're not in a underdeveloped country. We're in a fully mechanized, industrialized country that is one of the richest in the world. Maybe something needs to be done in order to protect those lives so that we all can live happy lives and enjoy those who are around us. Oh, there are some other issues that are going to be discussed throughout this particular episode. In why is it that it seems that the government is hiring private corporations to do the work that can be done by the public sector? They have government employees to do the work. Why do we need to go outsource it to a private company? Is there an issue of favoritism being played here? If you're friends with someone in government, well, here's a contract. It shouldn't work that way. And most of us as citizens would say that wouldn't exactly work that way. Now, while the Liberals and Conservatives are wrestling about trying to figure out who's going to investigate the situation, the issue at hand is ongoing. Maybe it's time that we as citizens demand that something be done so that our tax dollars aren't going to a private corporation for profits, and that our tax dollars actually do some public work, and that more government workers do some of the jobs that these contractors are doing. Maybe hire the contractors to do some of the work that cannot be employed by government workers. And maybe there should be a little more transparency around these contracts, because ultimately these contracts are issued in we, the citizens, and the residents who live in this country. It's placed in our names, and we ultimately pay the tab with tax dollars and programs that don't get put in place. So, with that, there is also a premier's meeting with the Prime Minister over the issue of healthcare, and we're going to listen to at least one of those premiers from the Northwest Territories talk about what they would do with the money that would be handed to them from the federal government back to the issue of healthcare and keeping people healthy, well, and happy.
Bonjour, good day. I'm joined here today with three leaders representing thousands of healthcare workers. Michael Hurley is the president of the Ontario Council of Hospital Unions. Angela Preocanin, first vice president of the Ontario Nurses Association, and JP Hornick, the president of Ontario Public Service Employees Union. We all share a vision for healthcare that is there for people when they need it, that's ready for people if they ever fall in that position, that no one should have to wait in pain because there's not enough healthcare workers, that the size of your wallet or how much money you earn should not determine the quality or the speed at which you receive healthcare. Sadly, we know that's not the case right now with Prime Minister Trudeau. Right now, the reality is we're seeing things getting worse and worse. We have seen that people are waiting for hours and hours in emergency rooms, sometimes days. We know that people are waiting in pain for important surgeries. And we know that healthcare workers are burnt out and exhausted. We're not surprised that in response to this serious crisis that the Conservatives are leaning into and celebrating a solution that involves for-profit privatized care. That's in their playbook. That's what they've always wanted. But we are surprised that the Prime Minister is now calling privatization innovation, when not too long ago he was very critical of the for-profit private solution as something that would hurt our healthcare and hurt people. Now, we have a decision in front of us, and we're putting a choice in front of Prime Minister Trudeau. He can choose to invest in the public universal healthcare system and hire more healthcare workers, or he can choose to go down the path of private for-profit care, which will only make things worse. We believe that we need to rebuild our healthcare system, and that means investing in the workers, investing in the frontline workers to make sure people get the best care possible. For the upcoming discussions with the premiers, our priority is that any agreement that does not include clear commitments to hire more frontline healthcare workers would be a failure. And that what we need to happen right now are investments to save our healthcare system, to hire more frontline healthcare workers. Ottawa needs to urgently partner with provinces to retain, to recruit, to train, and to respect healthcare workers. That is something that can be done and needs to be done. Donc aujourd'hui, je veux remercier la participation des chefs des syndicats qui représentent des milliers de travailleurs de santé. Aujourd'hui, on a avec nous Michael Hurley, président Conseil des syndicats d'hôpitaux de l'Ontario. Angela Preocanin, première vice-présidente Association des infirmières et infirmiers de l'Ontario. Et JP Hornick, président du syndicat des employés de la fonction publique de l'Ontario. Et nous partageons une vision de notre système de santé. Un système qui est là pour vous quand vous avez besoin. Un système qui ne répond pas aux besoins des gens. Et un système qui est prêt quand vous avez besoin, où personne ne devrait être obligé d'attendre dans la douleur pour recevoir les services. Finalement, un système qui ne dépend pas sur combien vous gagnez comme salaire ou combien d'argent vous avez dans la banque, que tout le monde peut avoir accès aux des services de qualité. Mais malheureusement, on sait que ce n'est pas le cas maintenant. Avec Premier ministre Trudeau, les choses ont empiré. Maintenant, les listes d'attente dans les centres d'urgence sont trop longues. Ça prend des heures et des heures et des temps, un jour pour recevoir les services. Des gens attendent dans la douleur pour recevoir les opérations. Et on a des travailleurs et travailleuses de la santé qui sont épuisés. C'est vraiment une crise de système de santé. Ce n'est pas surprenant pour que les conservateurs, et Pierre Paul-Hus, évidemment incluant, sont applaudis. Ils applaudissent la privatisation à but lucratif des soins de santé comme solution pour régler les crises. On sait que ça ne va pas régler les crises, mais ce n'est pas surprenant que c'est ce que les conservateurs proposent ou ils applaudissent cette décision. Mais on est surpris que le Premier ministre Trudeau applaudit cette privatisation parce qu'il a critiqué cette même approche il y a 2 ans. Maintenant, il appelle la privatisation l'innovation. Et c'est la mauvaise chose à faire. Parce qu'on sait que ça ne répond pas au problème. Ça ne règle pas le problème de notre système de santé. Parce que le problème de notre système de santé, c'est un manque de travail de santé. Donc, Justin Trudeau a un choix aujourd'hui. Est-ce qu'il va investir dans notre système de santé public et embaucher plus de travailleurs de santé, ou est-ce qu'il va continuer de laisser les provinces ou d'investir dans la solution de privatisation à but lucratif? On dit que maintenant, on a un choix comme pays. Si on veut défendre notre système de santé public, on doit investir et on doit embaucher plus de travailleurs. Donc, on présente cette solution au Premier ministre. Vous pouvez investir dans le système public, embaucher plus de travailleurs, régler les crises, ou investir dans le système de privatisation à but lucratif et empirer les choses. On pense que Ottawa doit travailler et collaborer à toute urgence avec les provinces pour régler ces crises. Ça veut dire aider comme un vrai partenaire pour embaucher plus de travailleurs de santé. C'est quelque chose qu'on peut faire et on exige le gouvernement de le faire. Now, I would like to introduce Michael Hurley, President of the Ontario Council of Hospital Unions, to share his perspective. And again, I want to thank him for being here. Michael.
Thank you very much. Good morning. Death rates in private hospitals and private clinics are higher on average by 2% than their public counterparts. Outcomes are less successful. Costs are higher. Over 30% higher for the 5,000 cataracts, which were announced as awarded to Herzing Corporation here in Ottawa just last week. Private clinics and hospitals bleed staff from public hospitals. 37,000 positions out of 260,000 positions in Ontario hospitals are currently unfilled, and the annual attrition rate of 15% a year adds tens of thousands of additional vacancies. This personnel crisis has driven the closure of over 100 emergency departments over the summer and fall in Ontario, as well as the closure of other programs and the cancellation of surgeries. But commercializing hospital surgeries and diagnostic procedures is a top priority for the Ford government, and sadly, this is happening with the tacit support of the Trudeau government. It is in this context that the deliberate understaffing in our hospitals, the degraded compensation for the workforce, the impossible workloads in Ontario hospitals should be viewed. We know that the Ford government is using the current weakness of the public hospital system against it to privatize a backlog of surgeries and diagnostic services. We know that the federal Liberal government is anxious to be seen to be actively supporting hospitals, which are in crisis across the country. But the federal government's requirement of Ontario to collect data is cynically politically expedient. It won't stop the bleeding out of scarce healthcare workers, and it isn't efficient cost-wise, but it certainly gives the appearance of action. We know that privatization can be a road from which there may be no turning back. If the Ford government believed it had the support of Ontarians, it would not have announced privatization plans in the summer months. It is afraid of a fight on this issue. People in Ontario are committed to defend publicly delivered health care and will give them that fight and continue it until the end of the next election and beyond, until we wear them down and wear them out. We have the capacity to do that. The Trudeau government stands at a crossroads and needs to decide where it stands on this issue of privately delivered care. Today, we call on the Prime Minister to come down solidly on the side of not-for-profit delivery of hospital services and to make this a requirement for additional federal funding. Thank you.
Thank you so much, Michael. Now I'd like to ask Angela Preocanin, the first Vice President of the Nurses Union of Ontario, to share her experiences and her thoughts as well. Thank you so much.
Hello, everyone. My name is Angela Preocanin, and I'm a proud RN and the first Vice President of the Ontario Nurses Association. ONA represents 68,000 nurses and healthcare professionals across the province, including 18,000 nursing students. I want to thank Jagmeet Singh for having invited us here today for your steadfast support of our public healthcare system and the nurses and healthcare professionals that work day in, day out providing care. We are at a critical moment for public healthcare in Ontario and in Canada. ONA is proud to stand with fellow healthcare professionals today, calling on Prime Minister Trudeau to keep Canada's healthcare public. As the Prime Minister prepares to meet with the premiers to discuss healthcare, we are calling on Mr. Trudeau to require that federal healthcare transfers to the provinces must be invested in public, not-for-profit delivery. This is essential to ensure that the staffing and care crisis in our public healthcare system does not get worse. We cannot allow for for-profit companies to poach nurses and healthcare professionals from our public hospitals. To truly improve public healthcare, the federal government must increase federal transfer funding with the right conditions in place to ensure that funding goes towards increased staffing, improving patient care, and not padding corporate pockets. That means enforcing the Canada Health Act and requiring provinces to implement a comprehensive strategy to retain and recruit all nurses and healthcare professionals into our public healthcare system. In Ontario, Premier Ford seems determined to privatize healthcare system and to let private companies profit off for healthcare. We can't let this happen. The Ontario's public healthcare system is not Doug Ford's or any premier's to dismantle and to sell off to their corporate buddies. Our public healthcare system has been built up over generations and belongs to all of us. The Ontario Nurses Association is working hard, hand in hand with our allies in the labour movement, and we're calling to the federal government to use its power to preserve and protect our public healthcare system and to stop this dangerous plan to privatize healthcare, hospital care, and by imposing on the transfer of federal healthcare funding. Thank you.
Thanks so much. Thank you, Angela. I really appreciate your words. Now I would like to introduce JP Hornick, the President of Ontario Public Service Employees Union, to share some words as well. Thank you so much. Thank you.
Good morning, everyone. I'm JP Hornick, President of the Ontario Public Service Employees Union, and I'm here on behalf of OPSU SEFPO's 180,000 members across Ontario, and the 60,000 of whom are working in Ontario's public healthcare system, a system which the Ontario government has been actively underfunding and draining of staffing in order to justify its clear privatization agenda. Ontario's healthcare crisis has been manufactured to allow our public system to fail. We can do better, but privatization isn't the answer. It will not solve the healthcare crisis. It won't solve the staffing crisis. It will make healthcare less accessible and less affordable. It will pull staff and funding away from the public healthcare system. It will worsen wait times. Upselling at private facilities will mean higher costs and less access for those who can't afford to pay. The formula is not new. Create a crisis, then privatize. The formula to create a crisis in the public service is to starve it of funding, worsen working conditions by doing things like deliberately reducing staff levels, by restraining wages, by driving people out deliberately, and then offer private clinics as the only possible solution. We have seen this before, but we know that with political will, at meetings like the one taking place right now between Prime Minister Trudeau and the health ministers tomorrow, many of these problems can be fixed. As a matter of fact, they must be fixed. Keeping healthcare public must be the goal, not just one in a series of options, because it is central to the profoundly important principles of equality and accessibility that we base our Canadian identities on. It ensures that everyone, no matter what their income status, gets equal high-quality access to care. That commitment to equality is what makes public systems better than any other, and it is worth fighting for. There's absolutely no doubt that more healthcare funding is needed in Ontario. We need the federal government to pay its fair share, and we need them to protect our public health care system in the process. After all, the Canada Health Act is federal legislation. New funding must come with conditions, along with full transparency and accountability. It must come with guardrails to protect the public not-for-profit system, to ensure that provinces actually put that funding into public frontline care, into staffing, into supporting workers on the front lines, not into shareholder profits. Canadians are struggling to make ends meet right now, and we can't afford additional medical costs that could tip us into bankruptcy. Like many of our neighbors just to the south, enough is enough. Many Canadians assume that universal public health care will always be there, but it won't be unless all levels of government take action now. We will organize, we will fight, and we will win against the privatization agenda. And so, Prime Minister Trudeau, it's time to do your part and protect public health care. Thank you.
A huge thank you to each of our speakers. They really raised the issue of defending our public, not-for-profit system and the harms of the privatization schemes and how that will only make things worse. Again, a huge thank you. Un grand merci pour votre participation aujourd'hui. Maintenant, je suis prêt pour des questions. Right now, we're ready for any questions you might have.
Monsieur Singh, je veux bien comprendre, est-ce que donc cette entente-là avec les provinces doit être conditionnelle à ce que ces provinces-là n'aient pas recours au système privé? Vous, comme gouvernement, vous metteriez là, en place cette condition-là au transfert?
Dans notre avis, le gouvernement fédéral doit s'assurer que l'argent public va dans notre système public. Ça veut dire qu'on investit dans le système public, mais aussi pour régler la crise. Et la crise, c'est un manque des travailleurs de santé. Donc, c'est un principe, oui, de défendre le système public, mais c'est aussi efficace parce que la solution, c'est embaucher plus de travailleurs. Avec la privatisation à but lucratif, il n'y a aucune garantie que ça va augmenter les nombres de travailleurs. Effectivement, l'opposé va arriver. On va cannibaliser les travailleurs dans le système public. Donc, ça va empirer les choses. Donc, c'est exactement l'opposé de ce qu'on doit faire.
Donc, est-ce qu'il faut pénaliser des provinces comme l'Ontario qui ont recours déjà au système privé dans leur offre de soins?
C'est maintenant le moment quand on est dans les négociations de négocier une entente où c'est les conditions de cette entente. Donc, maintenant, dans les négociations, quand le Premier ministre rencontre les Premiers ministres des provinces, il doit dire que on va être un vrai partenaire. On est prêt de travailler ensemble. On doit travailler ensemble parce que depuis longtemps, les conservateurs et les libéraux au niveau fédéral ont coupé les investissements dans les soins de santé. Donc, on doit réinvestir plus d'argent, être un vrai partenaire, mais aussi on doit s'assurer que l'argent public règle le problème. Donc, ça veut dire l'argent public au niveau fédéral embauche les travailleurs, des médecins, les infirmiers, les travailleurs de santé.
Can I just get clarification on your stance in English?
Sure.
Are you saying no public funding towards private care, or are you saying there should be stipulations attached to public funding to eliminate private care in provinces? Can I just get your clarification?
Sure, yeah. Right now, we're up against a healthcare crisis. We're saying the public money that we use at the federal level should not be going to for-profit care. And while there's a negotiation happening right now, the Prime Minister has an opportunity to say, we will not be spending public money to invest in a for-profit delivery of care, particularly when the crisis that we're up against is a crisis of a shortage of healthcare workers. And putting money into a for-profit, privatized delivery of care will in no way solve the problem. And in fact, it'll only make it worse because the only way they can staff the for-profit clinics is to cannibalize or poach, as was said earlier, the workers in the public system. That in no way is going to help people who are dealing with long wait times in the ER. That is in no way going to help children who are struggling to get care at children's hospitals. So the proposal we have is based on principle, but also based in the reality of the problem that we're up against is a problem of a shortage of workers. So the federal government should not be putting any money to provinces that go towards for-profit delivery, and that money should go towards the solution, which is hiring more workers.
But Mr. Singh, that the Canada Health Act does not actually say that using a private clinic that's publicly funded in which the user, the individual patient does not have to pay is illegal. The federal government actually has no way of stopping that. It's part of the Canada Health Act. It's how it was conceived. Doctors technically are private practitioners in Ontario, for example. In BC, you're focusing on Doug Ford, but in BC, the NDP premier there has acknowledged they also use private delivery within a public system and that it's helping their system. So I don't understand why you're focusing on this rather than on the overall goal.
Let's just take the BC example. BC has acknowledged that they have, there exists private for-profit delivery of care, but what they're actually doing is going the opposite direction. They're actually purchasing for-profit clinics and bringing them into the public system. They've actually taken workers that were kicked out of the public system under the previous government and brought them back into the public system. The direction that BC NDP is going is great evidence where we all should be going, into hiring more public workers and to shifting away from the for-profit delivery into profit and into public delivery. So that's one. So the BC NDP is a great example. They're actually acknowledging that the past was the wrong decision and they're moving in the right direction, which is to include more public delivery and own or purchase back those private clinics. And in terms of what the federal government can do right now, we're in the midst of a negotiation. The negotiation is the opportunity to say, yes, we will deliver this money, if that money goes towards public delivery of care and particularly goes towards solving the problem. The problem that we're up against is one of not enough healthcare workers. So use the negotiations that we have right now to ensure that money goes towards solving the problem. And so we're talking about using the opportunity right now to meet with the premiers to say we will deliver money if that money goes towards solving the problem, hiring more nurses, hiring more doctors, hiring more healthcare workers. That's what we should be doing. Negotiating right now to solve the problem, not giving money to provinces to allow them to privatize care and have more money of our public money going towards profiting for-profit clinics. Very different from fee-for-service for a physician. We're talking about for-profit clinics. That should not be something that the public should be financing. What we should be financing is hiring more nurses, doctors, and frontline workers.
To be clear then, are you saying that as part of these negotiations, the federal government should require all provinces to do as BC did and buy back all of those private clinics and bring them back into the public system? Is that what you're saying?
So I'm saying that what BC NDP has done is the right thing. They're moving in the right direction. But what I'm saying that the federal government has to do right now is hire more nurses, doctors, frontline healthcare workers.
Hire anybody. They send money to the provinces.
What the federal government should do is to negotiate with provinces, say the problem that we're up against is a shortage of healthcare workers. We need to invest in hiring more healthcare workers. If you want the federal government to be a partner, we will be a partner. We need conditions or guarantees that the public money we spend actually goes towards hiring frontline healthcare workers. That's exactly what we can do in a negotiation. You talk about the conditions of the money. The Prime Minister was very strong on this. He said there's going to be conditions. I absolutely agree there should be conditions. Those conditions should be public money should solve the problem. Public money shouldn't go towards making a rich corporation richer. Public money shouldn't go towards a for-profit clinic being able to have more profit. Our public money should go towards solving the actual problem that we're up against, which is a shortage of healthcare workers. So the federal government should be a partner in solving that problem, working with provinces, delivering the funding to solve that problem, working in terms of immigration solutions, looking at national licensing solutions, but using our public money to actually solve the problem, which is hiring more workers.
Why does this matter to patients? I mean, if in Ontario, Doug Ford keeps saying you're not going to pay with your Visa card, you're going to pay with your OHIP card. So what does it matter to a patient, whether they're going to a public clinic or a private clinic, if they're getting the same service?
So we think about that parent that had to wait in the children's hospital for hours and hours while their kid couldn't breathe. For that parent, Doug Ford's quote-unquote solution will not make that wait time any less. That child will still have to wait for hours and hours, struggling to breathe because there's not enough frontline healthcare workers at the children's hospital. For someone who goes into an emergency room and has to wait 12, 15, 16, a full day of wait to get care in an emergency room and are worried right now. I've met people who are worried about doing activities because they think if I get hurt, I don't know what's going to happen if I go to an emergency room. For that person who's worried about getting care, or those people that are waiting for emergency services for hours and hours, Doug Ford's solution, quote-unquote solution, is not going to actually make anything better. And in fact, concretely, it will make things worse. Because where are those nurses going to come from? Where are those frontline healthcare workers going to come from? If there's a massive increase in for-profit delivery, they have to come from somewhere. They'll be pulled out of the public system. So you'll have emergency room nurses pulled out of the emergency rooms. You'll have frontline workers in children's hospitals pulled out of those positions into the for-profit private clinics, and it'll no way make those conditions better. It'll in fact make those worse. So all those parents worried about their kids, all those people worried about getting care in emergency rooms will have a worse outcome. Things will get worse for them. And so that's why it matters to patients. They want to see things get better. They want to be able to see a healthcare system that's there for them when they need it. And the solution is not going to happen from a for-profit delivery. It's going to happen if we had enough nurses, doctors, frontline healthcare workers to meet the needs of people. And that's what we need to do.
Mais à court terme, M. Singh, vous ne pensez pas que le patient, ça ne le dérange pas ben de voir un médecin au privé ou un médecin du public en autant qu'il ne paie pas? Le patient, ce qu'il veut actuellement, c'est voir un médecin. Quel est le problème actuellement à ce système-là, puisque le patient ne paie pas là, au bout de la ligne?
Je commence avec c'est quoi le problème en général, et puis je touche cette question de le patient ne paie pas. Donc, le problème en général, c'est si on parle de centre d'urgence, une grande liste d'attente, une liste d'attente qui est trop longue. Si on parle en général, les hôpitaux pour les enfants, les problèmes dans notre système de santé, ce n'est pas seulement une question d'opération, c'est les listes d'attente dans les centres d'urgence pour les enfants, pour les gens en général. La proposition, je ne veux pas utiliser le mot solution, donc je vais dire la proposition de mettre plus d'argent dans un système privé à but lucratif va empirer tout ça parce que ça va cannibaliser ces travailleurs qui travaillent dans le système public. Donc, s'il y a déjà un manque de travail dans le système public, dans les hôpitaux d'enfants, s'il y a déjà une pénurie de travailleurs de santé, ça va être pire encore si on cannibalise ces travailleurs et puis les embauche dans un système de privé. Donc, ça ne règle pas le problème, ça va empirer le problème. Si on parle des patients qui reçoivent les services privés à but lucratif, la vérificatrice générale de l'Ontario a dit que même si le gouvernement dit que les patients ne payent pas, ce n'est pas le cas. Souvent, dans les cliniques comme ça, les cliniques à but lucratif, les travailleurs vendent des services additionnels et les patients ne savent pas exactement ce qu'ils doivent faire. Et le résultat, par rapport à la vérificatrice générale de l'Ontario, les patients payent quand ils assistent les cliniques à but lucratif privées. Donc, ce n'est pas le cas qu'ils ne vont pas payer. C'est une menace aussi qu'ils vont payer. Donc, dans les deux cas, c'est un problème. C'est pourquoi on dit qu'on a déjà un système public, un système public qui n'a pas les financements nécessaires pour livrer les services. Donc, bien financer le système qui existe au lieu de bâtir un système complètement nouveau.
Zooming out a little bit, the premiers are demanding a 35% increase immediately, or sorry, an increase to a 35% cost share immediately, so that's $28 billion annually, plus a 5% annual increase on top of that. Does the NDP support that demand, or what is the level at which the NDP believes the Canada Health Transfer should sit at?
We ran in the last campaign in 2021 that we would like to see the federal portion return to 50-50. And so that's what we believe. Now, we acknowledge that that's something that can happen overnight, but we need a plan to get to that. And what we're looking for is a plan to get us back to being a real partner for healthcare delivery, acknowledging that's not something that can be done overnight. That's not something that can be done in one budget, but that's what we want to achieve again. We want to achieve a balance where the federal government returns to being a real partner in delivering healthcare so we can properly fund our healthcare system, make sure we've got the sufficient numbers of healthcare workers to respond to the needs of people, and make sure people can get the care they need when they need it. So that's our vision. So our vision is that we need to move there quickly. We need to do that prudently and responsibly, and we'll work with provinces. When I'm Prime Minister, that's something that I would focus on, getting to that point in a prudent and quick manner.
And when you,
Where do you think federal spending or federal contributions to healthcare stand at this point? I know the provinces say it's 22%, the feds say it's closer to a third. Where do you think it is?
I support the notion that, well, first of all, it's way less than it should be. I think we can start with that. And it's far less than what it used to be. There used to be a much more of a balance. So I think those are two things we can acknowledge. And that Conservatives and Liberals both cut that contribution. Most recently, Harper had a massive cut to it that Prime Minister Trudeau continued. So I think those are all things we can agree with. In terms of the exact number, I've said the 22% number, that's what the federal portion is at. Either way, it's significantly reduced and it needs to be increased.
but to Tom's point, the federal government's in part reduced its 22% share because they transferred tax points in the 70s, and that's why the feds actually say that it's closer to 35% or 40. So just when you're talking about doing equal share, so 50-50 between the feds and the provinces, what is your baseline? Because that obviously dramatically changes how much more money you believe should be put into the system from the federal government.
Well, fundamentally, we come down to the question of what does it mean to be a real partner? And overall, if we take a step back, it's clear the federal government hasn't been a real partner for decades. They've been reducing their contribution. They've been playing less and less of a role, and that's a problem. And we need to see that increased. We want to see the federal government's contribution increase. And under a new Democrat government, that's exactly what we do.
And going back to your point on that, expanding private care within a public system cannibalizes the human resources in the public system. How do you square that argument with the fact that you're saying your whole argument overall is that the government should be forcing provinces to hire more staff? Where are those staff coming from? Are they being canalized from the private system, or in one of your things are you saying there are staff available, and in another one are you saying there aren't staff available?
No, the staff's not available. So the emphasis that we need to focus on is the three things that a lot of healthcare workers and professionals talk about. We need to retain the workers we have. We need to recruit more workers, and we need to train more workers. And some of the solutions being proposed would be to put emphasis around more spaces for training. That's more of a long-term solution, of course. That's not going to happen overnight, but we do need to train more workers in Canada. We also can look at, and what's been proposed as a solution, is putting more resources towards ensuring that those who have international training, and there's thousands and thousands of Canadians with international training in healthcare that aren't working in their field for a number of reasons. The barriers to getting qualified are too high. The process is too complicated. So putting emphasis towards that and then hiring those workers once they qualify. There's also immigration barriers. I did a press conference with a number of frontline healthcare workers, specifically nurses, that were internationally trained, actually got their qualifications in Canada, but because of an immigration barrier, weren't able to practice in Canada. So there's a number of examples where we can increase the number of healthcare workers, but that's got to be the solution. And not that it's easy to do, but if the crisis we're up against by all the experts is that there's simply not enough healthcare workers. There's not enough nurses. There's not enough healthcare workers in general, personal support workers, care workers. There's not enough physicians. That's the problem. The solution has to be to increase the number. And that's where the emphasis should be going. That's where the resources should be going. That's where the time and the strategy should be going. How do we hire more workers to deal with the needs of Canadians?
Get you on pharmacare, it's part of your deal with the Liberals. When should we expect a bill to be tabled?
So in our agreement, it is by the end of the year, and we didn't stipulate a specific month, but it is by the end of the year that the Canada Pharmacare Act, or the legal framework to move forward with pharmacare, should be tabled and passed by the end of this year.
So doesn't that need to start soon? I mean, the legislative process doesn't happen in a day, right? So
Yeah, we haven't laid out in terms of what month. We just laid out a deadline. Similar to our dental care program, we said it has to happen by the end of the year, and we were able to achieve that for children under 12. That happened by the end of the year. So similarly, in this agreement, we have a number of things that have to be done by the end of this year, and one of them is a legal framework for pharmacare.
Just ask you about your dental care agreement, and that through that you're transferring public funds to private providers who are dentists. I'm just sort of wondering philosophically why you're okay with that, but you're not okay with private providers in the healthcare system.
Yeah, it's a different scenario entirely. We've got a public system already when it comes to hospitals and healthcare delivery. In the dental delivery, there is no public system, so we're We're not cannibalizing from a public system. There is no public system. And our view is ultimately with dental care, we want to roll it into the public system. But right now, there's millions of Canadians that have no coverage whatsoever. They have no access to dental care, and we want to give those Canadians access. So by the end of this year, seniors, teenagers, 18 and under, and people living with disabilities will have access to a federal program to look after their teeth. Ultimately, a new Democrat government would roll dental care into a public system, but there is no public system right now. When it comes to healthcare, though, there is a public system, and that public system has been starved. And so we think it's absolutely the wrong thing to do to invest in a parallel for-profit system when that in no way is going to solve the actual problem of a shortage of healthcare workers.
Can I just go back to the BC? I'm just a bit confused why you're spending so much time focusing and attacking Doug Ford when your own party, which runs the government at BC, is defending private healthcare within the public system. I know that they did buy back some of the clinics that were privatized, but Adrian Dix this past year defended the use. He said that having a small number of surgeries that increase our capacity, as long as there's no extra billing and they follow the Medicare Protection Act, I don't have any objection to that. So can you explain to me if you are okay, if you agree with Adrian Dix?
The fact that there is private delivery that exists, yes, it exists. But we look at the direction that the province is headed. The province is clearly heading in a direction where they think that it is much better to put those services into the public system. I've actually spoken with the health minister, and he says, yes, it would be much better if those services were actually included in the public system, and that's why we're buying them up. It's much better. It's better delivery, less cost. We get more patients that get care, better quality of care. So they're moving in the direction that we think that the whole country should move in, that care should be delivered in a public way. And that's why the province is spending money to buy up for-profit clinics, bring them into the public system, because it's better for healthcare delivery. We agree. The fact that they exist now, that's something that previous governments have allowed to happen, the wrong decision, I would say. And now what we need to do is build a system that we want for the future. Do we want a system where we have more and more for-profit private delivery, which we know will cost more? We know the quality will go down, and we've seen that very clearly. When there's for-profit delivery of healthcare, corners are cut to make that buffer for profit. We saw that in the long-term care homes, where the worst conditions of care were in the for-profit homes because care hours were cut, because staffing levels were cut. And as a result, people had horrible results. We saw horrific examples.
Care. He actually says it improved the system's capacity to deliver.
What he's also said very clearly is that we need to bring it into the public system, and that's why they're purchasing them, because it's better when it's in the public system. And the fact that there's some that exist privately is a fact. That's true. Governments have made that decision. What the New Democrats are doing in BC is saying that that was a bad decision. We're going to actually buy them back and bring them back into the public system because it's better for people, which we agree. And right now, either way, what we're up against is a healthcare worker shortage. There is no way anyone can justify how investing in a parallel private for-profit system will in any way deal with a healthcare worker shortage. It will not. So that is not going to help a kid at a children's hospital that has to wait for hours and hours. It's not going to help anyone that's waiting for hours and hours at the emergency room. It's not going to help people get access to a family physician when they can't find a family physician, where millions of Canadians don't have a family doctor. None of those problems get solved with a for-profit delivery. That's why we're saying, let's solve the problem. Let's actually give people what they need. Frontline healthcare workers, nurses, physicians, access to primary care, access to emergency care that doesn't take hours and hours. None of that is going to be solved by having a for-profit delivery of services. All of that can be solved if we hire more healthcare workers. Let's do that.
That's all the
Thank
time
you.
we had. This brings the end to the press conference.
Merci.
Thank you.
Thank you so much. Merci. Hey,
Good job.
thanks so much.
Thanks, Nicole. Good afternoon, everyone, and thanks for joining me here today. Premiers from across Canada will meet with the Prime Minister Justin Trudeau tomorrow to discuss Canada's healthcare system and what needs to happen in order for the healthcare needs of our residents to be met. The Northwest Territories is unique, and we have specific challenges that residents require to be met. Since before the pandemic, premiers have been asking for an increase to the Canada Health Transfer. This call has only become louder and more persistent as the pandemic has wreaked havoc on healthcare across the country. This per capita payment is an important piece of what pays for healthcare in the Northwest Territories. However, it does not do enough to address the extraordinary costs we are dealing with. As a small jurisdiction, per capita payments, as you know, don't benefit us as much as the more populated provinces. Health outcomes among Indigenous people, which make up more than 50% of the Northwest Territories, remain significantly troublesome compared to the better outcomes experienced by non-Indigenous residents. Our challenges are significant. We have a small population spread across 33 communities, many of which are some of the most remote in Canada. We struggle to achieve economies of scale. We feel that the impacts and legacy of colonization and residential schools regularly. All of these factors contribute to the reality that per person, we spend 4 times the national average on healthcare in the Northwest Territories. In a time when society and governments across the country are focused on helping the most vulnerable to ensure they have the supports and programs they need, we continue to deal with significant and unfair gaps. We need Canada. We need Canada to provide more healthcare funding so we can provide the health and mental health supports and services for residents of the Northwest Territories that they need, that they deserve. I'm encouraged that Canada is looking at both a Canada Health Transfer increase and bilateral agreements that can be focused on areas of highest priority within each jurisdiction. Canada has identified priority areas for bilateral agreements. The areas are the primary health, mental health, long-term care, virtual care, and data collection. But we have also indicated that we need to be flexible to meet our own priorities. I don't have any more details on exactly what will be discussed tomorrow, but I do look forward to meeting with the Prime Minister and all premiers tomorrow to find a path forward on healthcare that is sustainable to our system. On that, I'm going to turn it back to Nicole to moderate the question and answer period of this media availability. And again, thank you for being here.
Thank you, Premier. We will now move on to the question period. As I mentioned earlier, each news outlet will have the opportunity to ask a question and a follow-up. If we have time to go through the list a second time and give every news outlet an additional question, we will do that. Again, I remind you to please mute your mics until you are called upon, and please mute yourself again after you have asked your question. So the order was posted in the chat, and it will be as follows. We will start with CPAC, and then move on to CBC, then Cabin Radio, and then Media Tinois. Am I missing anyone? Okay, I will take that as a no. So we will start off with CPAC. Richard, are you ready? Richard, I'm not hearing you.
Oh.
Hello.
Hello.
Hello, Richard.
We're just standing by for the meeting. No, sorry, my mistake.
Do you have a question, Richard?
No, I do not.
Okay, thank you. We'll move on to CBC. Megan?
Hello, can you hear me all right? Awesome. I'm wondering, you mentioned the priority areas, that Canada had outlined for its bilateral agreement. I'm wondering if you can elaborate, Premier, on what on the NWT priorities that you will be pushing in the meeting tomorrow.
Well, the Northwest Territories, like I said, is unique. We have 33 communities spread over a vast area of land. Many are inaccessible except by plane or winter roads. Our healthcare system is not as comprehensive in the south. In fact, we use Alberta a lot for a lot of our services. So our costs are higher. And that's the biggest thing I need to emphasize to the federal government is that you can't fund us per capita. It doesn't work for us. It doesn't work in any of the programs that we get funded for. I think the other really priority for me is we have the Council of Leaders table, and when it comes to healthcare, mental health and addictions was the #1 priority identified by all leaders around the table. So respecting the leaders of the Northwest Territories, mental health and addictions needs to be a priority for the Northwest Territories going forward.
Oh, awesome. Can I ask a second question?
Yes, go ahead.
Awesome. Yeah, I'm wondering as well, given that the entire country is competing for healthcare staff right now, how are you going to ensure that the NWT, as a smaller jurisdiction, like you mentioned, is included in those conversations and ensuring that we get the necessary staff as well?
Well, there's two things. I mean, of course, we need more financial funding for recruitment and retention, but there's more that we have to do. We're competing with the larger jurisdictions, and so we have to really focus on what the beauty of the North, why would people want to move there? What do we have to offer to people in the healthcare profession that would bring them to the Northwest Territories? So one part is the funding that we're seeking. The other part is really emphasizing the benefits of working in the Northwest Territories. Thank you.
Thank you, Megan. We'll now move on to Cabin Radio and Brooklyn Conley.
I have no questions at this time. Thank you.
Okay, thank you. Media Tinois, Raphael.
Yeah, I'm good also. Thank you.
Okay, thank you. Okay, with that, Megan, did you have any other questions since we're going to our second round?
I did actually.
Okay.
Awesome. I'm just wondering, you mentioned, of course, that mental health and addictions are a priority for many of the leaders in the NWT. If the NWT is able to obtain more healthcare funding through this agreement, would the Northwest Territories government consider building a residential treatment facility for the territory?
Thanks, Megan. I do think that, again, this issue has been brought up to the Indigenous governments through our council leader. Minister Green has had initial meetings with them. Once we discuss the bilaterals and we find out what exactly we're looking at, how much funding we're getting, etc., then I think that needs to go back to the council leaders table to address how we work together. Mental health and addictions isn't something that the JNWT can address alone. We need to work with the Indigenous governments on this. The majority of Indigenous people are affected by it, and so because of colonization and residential school. So we need to have those discussions at the larger table and to decide how we utilize our resources and the supports we provide for people. So, thank you.
We've had new revelations every day, it seems. As we've said in the House, you are the company you keep. McKinsey has had so many scandals around the world, their involvement with Purdue Pharma, their involvement with the Chinese government, the Saudi government, the Russian government, and yet this is a company that Justin Trudeau chose to go to repeatedly for contracts with the Government of Canada, work that the public service said they could do themselves. Now, the Liberal response to the McKinsey scandal has been to say they're going to have 2 cabinet ministers do an investigation. These are cabinet ministers that would have been responsible for the process all along. We don't believe that Liberals can be trusted to investigate other Liberals. That's why Conservatives are calling for the Auditor General to conduct an independent investigation into what happened with the spending on McKinsey. Conservatives will be moving a motion today in the House, a concurrence motion, to have the House of Commons endorse a recommendation from committee asking the Auditor General to come in and do this investigation. We don't trust Liberals to investigate themselves. We don't trust the 2 ministers who are responsible for procurement and for the Treasury Board to be the ones investigating their own conduct in this respect. That's why we think an independent investigation of the Auditor General is important, and we will be moving a motion after question period today asking the House to endorse this call on the Auditor General to conduct the independent investigation. I'll now turn it over to my colleagues.
Thank you, Garnett. This motion also calls upon the Auditor General to evaluate these contracts with the lens of value for money and performance. At this moment in time where Canadians are facing 40% increases in inflation, where 67% of Canadians believe that Canada is broken, Canadians need to see value for money. And we're not convinced that the government got value for money with these McKinsey contracts. We've seen cases of inflating the prices, for instance, where McKinsey has inflated their contract prices up to 193%. We know that 20 of 23 of these contracts were awarded in a non-competitive environment, no competitive process. We're very concerned about the use of funding. We saw the story come out of the Business Development Bank of Canada, where we saw extreme expenditures with these funds. And of course, we're very concerned about performance at a time where we have brought in so many more public servants in addition to the services of McKinsey, and yet we can't seem to point to the value that these consultants have brought to the public service. I'll use immigration as an example, and I have a quote here from an IRCC official. We had a few presentations on very generic, completely vapid stuff. They arrived with nice colors, nice presentations, and said they would revolutionize everything, one of the sources said. In the end, we don't have any idea what they did, the source added, referring to nice marketing that isn't science. And I'd have to say that the 2.1 million backlog that we're seeing at IRCC speaks to this. So we are very interested to bring this motion forward in the House to have the Auditor General investigate to see really what happened with these contracts. Et maintenant, je vais passer la parole à mon collègue, Monsieur Pierre Paul-Hus.
Merci Stéphanie, Garnett. Bonjour tout le monde. Ce que nous voyons aujourd'hui, c'est vraiment, quand on peut dire que le Justin Trudeau, 8 ans de gouvernance de Justin Trudeau, ça nous amène à quoi? Ça nous amène à avoir encore plus de questions et à avoir des centaines de millions, des dizaines de millions de Canadiens qui trouvent que la vie coûte cher. La vie est dure pour plusieurs personnes, sauf les amis du gouvernement libéral. Des firmes comme McKinsey, des firmes qui ont vu une augmentation de leur contrat augmenter fois 50. Des fonctionnaires qui ne comprennent même pas en quoi concernent les contrats. Les hauts fonctionnaires disent « On a des contrats qui ont été donnés à McKinsey, mais on ne sait pas c'est quoi le résultat de tout ça, ça sert à quoi? » Donc, des questions que les Canadiens sont en droit de recevoir des réponses. Et c'est pour ça qu'aujourd'hui, avec mes collègues, les conservateurs, on va déposer une motion à la Chambre des communes, demandant expressément à la vérificatrice générale de faire la lumière sur toute l'histoire qui entoure McKinsey. Il y a beaucoup trop de questions sans réponse actuellement et la vérificatrice générale a les pouvoirs, les outils pour aller chercher les réponses aux questions des Canadiens. Parce que là, comme je disais au début, depuis 8 ans du règne de Justin Trudeau, tout ce qu'on voit, c'est des scandales qui s'accumulent, des dépenses hors de contrôle, l'inflation qui monte, les taux d'intérêt qui montent, et le Canadien moyen en arrache. Tout le monde paye plus cher. Puis comme ma collègue disait, 67% des Canadiens disent que le Canada est brisé. Ça veut dire quoi, le Canada est brisé? Bien, ça veut dire qu'il n'y a rien qui marche correctement. C'est la machine gouvernementale, tout est tout croche. Et pendant ce temps-là, les amis du gouvernement libéral continuent de recevoir des centaines de millions en contrat et on n'est même pas capable de savoir pourquoi. Donc, c'est le but de l'objectif aujourd'hui, de faire la lumière et de demander à la vérificatrice générale de creuser davantage. Merci.
Why are you guys focusing on McKinsey when the amount of money from the federal government going to McKinsey is a drop in the bucket compared to the other big consulting firms?
Well, first of all, Conservatives have been critical of the government spending in general with respect to outside consultants, so it's not an exclusive focus. But let's look specifically at the issue with McKinsey. Significant growth in spending. Meanwhile, this is a company that advised Purdue Pharma on how to turbocharge opioid sales. Dominic Barton, who was the managing director at the time, claimed to have no knowledge of that when he was leading this company for over...
You're looking at government spending and where government is possibly not spending appropriately, why not go for the big fish rather than small fish?
No, Conservatives have been raising these issues across the board. Well, no, I think I disagree with that respectfully. We've been raising government spending on consulting in general, but in particular with respect to McKinsey, Dominic Barton was leading the Prime Minister's Growth Council while at the same time the company he was leading was selling to the government. We're concerned about conflict of interest there. We're concerned about the fact that this is a company that was doing work for Chinese state-owned enterprises, advising a Chinese state-owned enterprise in particular on the construction of militarized islands in the South China Sea, working closely with the Russian government. So I think there are some particular issues with McKinsey, but there are issues more broadly as well with consulting. So our focus is to say the McKinsey spending, the choices the government have made there, their close relationship with this company needs to be investigated in particular, but we also need to look at the spending on consulting companies in general.
Garnett, would Conservatives do business with McKinsey if you folks were government?
Pierre Paul-Hus has been very clear about firing the high-priced consultants, about saying we're spending far too much on this, and with the current track record of McKinsey, we cannot work with a company that's behaving in the way McKinsey has.
Monsieur Paul-Hus, j'aimerais vous entendre. Est-ce que vous aimeriez voir une enquête du commissariat au lobbying? Parce qu'on a vu ce matin qu'ils ne sont pas inscrits au registre des lobbying, du lobbying autant à Québec qu'à Ottawa. Est-ce que vous pensez que ça mérite une enquête de ce côté-là?
Absolument. Il faut voir pourquoi, en plus, une entreprise comme McKinsey, comparée aux autres entreprises, ne sont pas inscrits au lobbying. Donc, tout le secret, le mystère autour de McKinsey, on doit faire la lumière là-dessus, évidemment. Et puis, ça demeure que la question revient souvent, pourquoi pas les autres entreprises? Mais c'est que McKinsey a plusieurs tâches à son dossier au niveau mondial. Si on se rappelle, si on regarde les documents qui ont été soumis au comité des opérations gouvernementales, on voit que McKinsey, à l'époque, avait un petit peu de contrat, oui, sous le gouvernement conservateur, mais à partir de 2014, aucun contrat, 2015, et les contrats ont repris très fortement à partir de 2016. Et c'est là qu'il y a un point, clairement, un lien avec le gouvernement libéral, et c'est pour ça qu'on veut savoir qu'est-ce qui se passe.
J'aimerais vous entendre sur l'enjeu de la santé, parce que c'est le gros dossier cette semaine, les premiers ministres sont en ville. Moi, la question que j'aurais, c'est de savoir si un éventuel gouvernement conservateur donnerait suite à des ententes conclues avec les provinces, si elles sont sur 10 ans, par exemple. Est-ce qu'un gouvernement conservateur donnerait suite à ces ententes-là?
Bien, premièrement, il faut attendre de savoir ça va être quoi la proposition du gouvernement fédéral face aux provinces. Nous, de notre côté, on a beaucoup de propositions, comme M. Poilievre a déjà mentionné, des propositions pour améliorer, changer les critères pour la reconnaissance des diplômes des médecins et des infirmières, également l'approbation de certains médicaments, que ça prend beaucoup trop de temps au Canada. Donc, mais pour l'instant, il faut le revoir.
Est-ce que vous seriez dans l'ordre d'un 5 par année, 6 par année?
On n'est pas en mesure aujourd'hui de parler de pourcentage sans avoir l'ensemble des critères autour de la table, et on va voir premièrement ce que M. Trudeau va proposer. On pourra se faire une meilleure tête là-dessus.
But you don't wait on other topics, though. You don't wait to hear what the government is proposing. You guys, the Conservatives, have proposed what they believe should happen in terms of funding for other measures. So why are the Conservatives not disclosing how much you think is appropriate to increase health spending by?
Well, you're going to see a very detailed platform from us, obviously, at the appropriate time. We have, though, at the moment, put forward very specific proposals in terms of what's needed to improve healthcare. We put forward specific proposals around improving credentialing, addressing the significant gaps we're seeing in the health workforce. We have people coming to this country who are trained to work in the healthcare field who aren't able to work in that field. So we'll be putting forward constructive proposals as we go, and I can assure you that we will have very detailed proposals around kind of the full spectrum of policy areas at the appropriate time.
But does the Conservative Party believe that part of the proposals to improve healthcare in Canada should include increased federal funding for it?
Well, what we've seen over the last 8 years is that Justin Trudeau has thrown money at all kinds of different challenges, and in general, things are getting worse. What we need to see from the government is constructive engagement, is an effective plan. We'll critique that plan when it comes forward. We'll propose our own plan at the appropriate time, and our focus, and what I would say is that our focus is on preparing and putting forward that plan, but also on constructively putting forward proposals that are going to help us move forward, such as improving credentialing, such as ensuring that those who are trained to work in healthcare are actually able to work in healthcare in this country. Again, when we see a proposal from the government, we'll review it. We'll see whether the government's actually going to get us out of the failures they've caused. It's been 8 years, and I think you'd be hard-pressed to find any Canadians who would say healthcare is better off today than it was 8 years ago. So Justin Trudeau's going to talk about throwing money at problems. We're going to have to be pressing to see if there are actual solutions to the challenges that our country faces.
Will the Conservatives follow or honor the agreement that Justin Trudeau strikes if the Conservatives?
Well, I obviously can't comment on that because I haven't seen the agreement, right?
Well,
Go ahead.
Dans le dossier McKinsey, vous défendez beaucoup les fonctionnaires fédéraux. Les fonctionnaires, en ce moment, sont en négociation pour une nouvelle convention collective, demandent 4,5 de hausse, le gouvernement 2 %. Qu'est-ce que le gouvernement devrait faire pour éviter la grève?
Ben, ça fait partie, encore une fois, des nombreux dossiers qui sont compliqués avec le gouvernement de Justin Trudeau. D'avoir une discussion appropriée avec les syndicats, c'est la moindre des choses avec la fonction publique. Ça fait 2 ans qu'il n'y a pas de discussion, pas d'entente. On parlait de retour au travail au printemps passé. La présidente du Conseil du Trésor disait « Oh, on a des plans de retour au travail selon les départements. » Je veux dire, c'est toujours du n'importe quoi.
Okay, mais c'est quoi une approche raisonnable pour vous? C'est quoi une bonne offre pour la part du gouvernement?
Pour les montants, je veux dire, on n'est pas là à savoir est-ce que les revendications sont viables ou non. Le point, c'est de trouver, c'est toujours une négociation. Le gouvernement négocie avec sa fonction publique. On doit être en mesure de trouver un terrain d'entente. Là, c'est au gouvernement actuellement de savoir à quel point il se situe et pourquoi il y a un achoppement et pourquoi il y a un risque de grève de la fonction publique. Demander au gouvernement, c'est plus à la présidente du Conseil du Trésor qui pourrait vous dire.
Juste pour revenir sur les transferts, est-ce que vous êtes en faveur d'une augmentation ou pas sans la chiffrer? Est-ce que vous êtes au moins capable de dire si vous croyez qu'il faut les augmenter, les transferts? Parce que les provinces disent qu'il y a des gros besoins actuellement.
Actuellement, le dossier, effectivement, des transferts en santé est un dossier très problématique parce qu'il y a un manque de cohésion, un manque de... le gouvernement fédéral, Justin Trudeau, veut s'impliquer à gérer le système de santé des provinces, alors que lui-même n'a même pas été en mesure de bien gérer la pandémie. Pour nous, ça a toujours été du côté conservateur d'avoir des transferts qui soient stables, prévisibles. Ça, c'est un facteur prédominant. À quel niveau, ça sera à voir. On a nos propres évaluations à faire. Pour l'instant, on va voir ce que M. Trudeau va proposer aux provinces. Mais ce qu'on peut voir, c'est qu'il y a d'autres problèmes aussi au-delà de l'argent. Il y a aussi des problèmes avec l'immigration. On pourrait avoir des médecins, des infirmières de façon beaucoup plus rapide qui viennent de l'immigration. Avoir aussi des médicaments qui soient approuvés de façon plus rapide, qui empêchent des gens d'être obligés d'aller aux États-Unis pour se faire soigner. Donc, il y a plusieurs choses qu'on peut faire du côté fédéral. Oui, l'argent, c'est une chose, mais aussi, il y a d'autres choses qu'on peut faire pour améliorer le système. Merci.
Stable doesn't mean increasing, though.
So, we've heard a little bit about how the Conservatives want to see the Auditor General go to work and investigate what is happening with tax dollars over private contracts. We've heard from the NDP leader talking about how healthcare is a serious issue, but more importantly, we heard from the Premier from the Northwest Territories talk about real issues that she could use the funding in order to create programs for the residents and citizens of her territory. It's no longer high level when you hear what somebody wants to simply do to help the people who put her in office. That person isn't just simply a politician. That person is a public official trying to do what is best. So we thank and we're grateful for all of those who take the job of public service seriously, and that is the reason why they even ran for office. So I propose this as we close this show, that look, it is our responsibility as citizens in order to show up and vote for those people who want to just simply do a job to help our communities. And they're not there for the power of it all. They're not there because, hey, I'm going to collect this really cool pension check that no one can ever take from me. They're not there for any of that. They're there because they saw a problem, they wanted to help the people, and that's who we should be placing in office regardless of party or affiliations. We should be putting people in office because they want to help our communities be better. It is our responsibility as citizens and residents of this country, of the province or territory that you live in, and the municipality that your house resides, that you go and vote for the person who is going to do the job just as we described. Thank you for listening today, and to please find that subscribe button wherever it may be if you're listening to us on Apple Podcasts, Google Play, Maybe it's podcast addiction. It could be Spotify. Go click on it so you can get continued updates from us here at Depictions Media Radio and from this show, Policy and Rights. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.